Thank you for being here today. I know you recently had a surgery with Dr. Prima. Can you first introduce yourself and tell us how long have you been a patient of Dr. Prima's?
I'm Erlinda of Valencia, California. I have been seeing Dr. Prima for like a year.
Wonderful.
Yeah.
And so what brought you to see Dr. Prima? What kind of symptoms were you having?
I had that feeling that as if there is coming out from my vagina, so it makes me very uncomfortable. So that's the reason why I want to see Dr. Prima.
Yeah. And how many years were you having that symptom?
It's like 4 years maybe, so very uncomfortable on my part. So, yeah.
And was it difficult for you to urinate or to have bowel movement?
No, I don't have any difficulty in urinating, but the only thing is that I am not comfortable with that feeling of there's coming out, so that bothers me so much.
Of course, of course. And so what did Dr. Prima recommend to you when you told her this?
Yeah, so she recommended for a surgery, but at first I'm hesitant. I don't like so.
Yeah. So what changed your mind in terms of getting this surgery?
You know, like 2 to 3 days before the surgery, I had an anxiety. So, and then the day of my surgery, we are preparing to go to the hospital. So I said, Lord, I give my life to you.
So you gave really full trust in the Lord and with Dr. Prima.
Because I want to be healed.
Of course.
So I thank Dr. Prima for this surgery.
Yeah.
She did, and it was really be of great help.
Good.
Yeah.
And so how was the surgery like? Do you remember after the surgery how you felt?
After the surgery, there was I feel good. I feel great. So I had on general anesthesia, and when I wake up, I said, "Oh, I my throat is hurts," and then I feel like going to the bathroom right away. But I was on what's this catheter. So I said, I want to the bathroom. I want to go to the bathroom. So, and then minutes later, they removed the catheter, and then I peed, and then like how many minutes after, and I peed a lot again. So
and were you in any pain? Did you feel like you had to take a lot of
at
pain
first, when
medication?
I peed, it's painful. There's pain. I
Yeah.
said it's different from the regular when you go to when you pee, but for the first, second, third, up to fifth that I peed, it's painful. After that, no more.
Oh, good.
Yeah.
And did you feel like you had to take a lot of pain medications to help after the surgery?
Oh, I am allergic to almost all of the pain medications,
Oh,
and I
okay.
can take only Tylenol 325 and the Norco. But I take only one Tylenol and like one Norco maybe, and that's all.
Okay, so it doesn't sound like you were in much pain at all after that.
Yeah.
Good.
Yeah.
So now it's been really 2 weeks after your surgery. How are you feeling now?
Oh, I feel good. I feel better than before. There is no feeling of that like something coming out anymore.
Right,
But
wonderful.
so
And
thank you.
Of course. And what was your experience like with the whole office staff here with Dr. Prima?
You're so patient to your patient. You are patient to your patient.
Yes. A good play on words. And would you recommend this surgery to any other
Yes,
patient?
because I have friends. I call some friends that they have the same problem, and they are scared of undergoing the surgery. So somebody called me, and she doesn't. She wants to ask information, So I said, you better go. And then there's nothing wrong.
Awesome.
Yeah.
So seeing how smoothly your whole experience was, it seems like this is something that other patients really could benefit from.
Yeah.
Wonderful.
Yeah.
Well, thank you so much for sharing your experience, and I'm so glad that you're feeling so much better now that you have the surgery.
Yeah, thank you
Thank
for
you.
all the staffs in here with Dr. Prima. And I hope I'll get better soon.
Yes, we hope so too. Thank you so much.